elements of our lecture. Now I will demonstrate for you of course, I will specify health definition, and enumeration, main characteristics of most important, very widespread risk factors. We will underline and substantiate importance of prophylaxis as process. We will characterize main screening methods. And of course, I'll inform you about disadvantages of daily preventive doctor's work and conclude. Now let's specify the significance of prophylaxis in our patient care. Two main goals of prophylaxis: maintenance of healthy people, or for people without confirmed or verified chronic diseases, and maintenance the quality of patient's life in the prevention of possible complications of chronic diseases, to the prevention of this disease recurrence, and of course, to the prevention of disability. Let's specify the definition of health. Health as main criteria of medical interventions or healthcare system measures. I hope you know very good this definition, but I shall specify it. It is full physical, psychological, and social well-being, not only absence of physical defects and diseases. Definition according to World Health Organization chapter. And another definition of health from position of medical care. It is decreasing of mortality, morbidity, and disability parameters which caused by diseases, chronic diseases, different disorders, and increase of health sensation, general health sensation in population. So all our efforts in healthcare system interventions should be directed on achievement of health sensation, improvement of this sensation. As for main concept of health and disease prevention, you can see a very interesting picture. You can specify the role of different risk factors in this process. This concept includes social and environmental policies and legislation, education, public awareness, public participation, and of course, participation of healthcare system. Now I will inform you about relatively new demographic index of population health. It is duration of healthy life. This parameter, this index based on parameters, calculated on parameters of mortality, morbidity, age, and stress. Age and stress. Now, else one definition, a very important term in prophylaxis related to prevention as a risk. Risk is likelihood of any unfavorable event. In medical practice, risk is likelihood of disease development, especially for patients which were under the influence of some factors. All these factors we can unite by one term, risk factors. What does it mean, risk factors? There are elements of social, cultural environment, also peculiarities of people behavior, usually unhealthy behavior, functional states, peculiarities, motivation in functional state, which in certain conditions can lead to the emergence and development phrenological conditions and even diseases. On this picture, of course, you can see very famous for you risk factors such as ecological pollutants, environmental pollutants, and unhealthy habits, patients' unhealthy behavior as overeating, watching TV very long, and it's also additional psycho-emotional stress sometimes. Also, you should know the concept of risk factors. This concept applies to them those factors that are characterized by the following regular connections with the disease development. Which characteristics? The presence and the level of risk factors in population has a regular connection with the prevalence of its occurrence. New cases of disease in a certain period of time, and the mortality from this disease. For example, elevation the level of smokers in population can very close, very strong, associated with morbidity and even with mortality level, lung cancer and other lung diseases such as chronic obstructive pulmonary disease. Level of the risk factor is higher among patients with disease, than the average level of this risk factor in the population. It's also a confirmed fact. Level of, for example, psycho-emotional stress is higher. All patients with arterial hypertension and coronary artery disease than the average level of psycho-emotional stress in the population. And L1 position, characteristic of risk factors concept. Reducing risk factors leads to lower incidence of acute complications of the disease and mortality. If we'll diminish the potential contacts between healthy and infected, for example, by any viruses such as COVID virus, coronavirus, if we'll diminish contact between people, we will decrease, we will the incidence of possible complications and, of course, risk of mortality due to this very serious disease. All risk factors we can classify on two big groups. First is modifiable risk factors. All modifiable risk factors we also can subdivide on behavioral and social. Behavioral and social are smoking, unhealthy nutrition, alcohol misuse, narcotization, low physical activity or sedentary lifestyle, unfavorable material and social status. There are modifiable behavioral and social factors. The next subgroup of modifiable risk factors are biological, pathophysiological, and pathochemical, such as elevated level of blood pressure, but not hypertension, periodically elevated level of arterial blood pressure, increased or elevated level of serum cholesterol, hypercholesterolemia, obesity, hyperglycemia, hyperinsulinemia, disorders of hemostasis, hyperuricemia, and others. Non-modifiable, let's characterize non-modifiable risk factors. There are sex or gender, patient's gender, age, race, and black race, for example, people more predisposed to arterial hypertension development, and genetic predisposition for any diseases such as cardiovascular, oncological, and others. Let's enumerate main criteria of risk factors. For most widespread conditions or deviations of physiological parameters, there are for systolic blood pressure, it is a level of arterial blood pressure 140 millimeters mercury and higher. For diastolic blood pressure, 90 millimeters, mercury and higher. For glucose level, it's general or total cholesterol level, 5 millimole per liter, or more than 200 milligram per deciliter. HDL, high density lipoproteins level, less than 1 millimole per liter. LDL level higher than 3 millimole per liter. Triglycerides level more than 1.7 millimole per liter. Blood glucose 6.1 and higher. Tobacco smoking, when we can consider the patient is smoker, then he daily smoking at least one cigarette and more. Other criteria of risk factors: poor diet, unhealthy nutrition, means excessive consumption of carbohydrates and fats, especially animal fats. Salt intake, more than 5 grams per day. Next is consumption of fruits and vegetables, at least 400 grams per day. Overweight, of course, it's also associated with poor diet, with sedentary lifestyle, and especially obesity. Then body mass index higher than, for obesity higher than 30, for overweight higher than 25 kilogram per meter square. Low physical activity, what does it mean? When we can consider it, means level of physical activity, such as walking at a moderate or brisk pace, less than 30 minutes per day it takes. If it takes less than 30 minutes daily. Abuse of alcohol. So that alcohol taken more than safety doses or recommended doses. And of course, narcotization. As far as you know, on first place among their non-infectious, chronic non-infectious diseases in practically almost all countries of the world, cardiovascular diseases, cardiovascular pathology such as coronary artery disease, arterial hypertension, all cases of especially coronary artery diseases are associated with high cholesterol, serum cholesterol level. But as we know, cholesterol is modifiable risk factor, biological or pathobiochemical risk factor. This modifiable risk factor also for total mortality and cardiovascular mortality. In the United States, has been estimated risk influence of total cholesterol. Approximately 97 million people have elevated total cholesterol level more than 200 milligram per deciliter, and 38 million else more than minimal pathological level, more than 240 milligram per deciliter. It was found that a reduction in total cholesterol results in a reduction in the incidence of cardiac heart coronary heart disease events, such as myocardial infarction. For every 10% reduction in total cholesterol cases, coronary heart disease mortality is reduced by 15%, and total mortality reduced by 11%. So it's very modifiable risk factor. Also, in special clinical trials, proved that increasing the cholesterol level in population on 1% increases coronary heart disease mortality on 2%. Lowering cholesterol level 1% in the population reduces cardiovascular coronary heart disease mortality also on 2%. And lowering most unfavorable low density lipoprotein cholesterol level by 26% can reduce or reduces the likelihood of unfavorable coronary events such as MI by 47%. Very significant optimization, very significant improvement. How we can organize this effective prevention with effective correction, we'll discuss later. Now let's look on this picture. This picture demonstrates three different groups of food, which contains different concentration of cholesterol, total cholesterol, external cholesterol. Left part contains high level of cholesterol. It's red meat, shellfish, sausages, especially beef, lamb, and pork meat. This group promotes increases in cholesterol level and atherosclerosis. So-called. And the second part, butter or bacon. This group contains very rich saturated fats and cholesterol, most harmful for arterial health, arterial well health. Middle group, of course, contains less cholesterol level than left than previous, but also contain fats cannot be said to reduce cholesterol. But prescription of this food can replace red meat or, for example, shellfish. It is fish. This food includes fish or skinless poultry, and margarine instead of butter, bacon, and animal fats. But you have to know that, however, margarine contains trans fats, fatty acids, that foster also arteriosclerosis. And the rye group, which contains legumes, meat, analogs, virgin olive oil or seed oil, herbal food, contain no cholesterol, absolutely 0% of cholesterol or fat that foster its production in the body. And also contains fibers that also reduces cholesterol level and prevents atherosclerosis. So we have to recommend in our practice, especially for patients with increased level of cholesterol, and of course for patients with confirmed coronary heart disease, we should recommend this food and this oil. Now let's specify definition of term prevention. What does mean prevention? Prevention is activity, any activity aimed at preventing any events. In medical practice, prevention, a wide and very wide field of activity aimed at identifying the causes of diseases and the injuries, their removal or weakening from individuals, groups, and the general population. What is the importance of prevention? According to results of modern clinical trials, for example, in the United States, we found that more than 50% of deaths from 10 lead course due to lead cause due to factor which it is a possible repair. So reversible risk factors, modifiable risk factors. And success of preventive work depends on doctors' knowledge about risk factors and effective methods, its early detection, and of course depends on timely prescription of effective corrective measures, which can decrease this risk level. Let's specify the role of preventive inspection of health or preventive prophylactic health examination. This examination includes assessment of the risk of disease and selection of the optimal ways of its prevention, taking into account gender and patient's age, social status, and level of the patient education. Frequency of this, periodicity of this examination depends on the need to monitor the appointment's previous visits. Usually, it's yearly, one time per year, if no any reasons for additional examination, extra examination. Two kinds: preventive inspection, preventive examination. You should remember preliminary examination, for example, before entering the manufacturing, harmful plants where workers can come into contact with harmful factors, food industry workers, kindergartens, health camps, sanatoriums, and organizations or healthcare organizations. And periodic preliminary, periodic preventive inspection, annual survey to assess the health status of the dynamic. Also for all categories, almost for all categories of people or workers. You should know, you should remember 4 types of medical prevention, 4 types. There are primordial, primary, secondary, and tertiary. Maybe you didn't hear about primordial prophylaxis. Now I'll try to specify this term, try to describe this term for you. So primordial prophylaxis is a set of measures aimed at preventing the risk factor of the disease, prevention of the even contact of patients with possible risk factors of any disease, such as associated with poor living conditions, environmental unfavorable factors, and working environment, and unhealthy lifestyle. Even prevention of bad contact. Prevention of contact with smokers, prevention of contact with any narcotics application, prevention of contact with any environmental harmful factors such as ionizing radiation, air pollutants, and that. So creation of ideal atmosphere means primordial prophylaxis. In primordial prophylaxis, very important to organize activity in the field of public health, so-called maintenance of health among healthy people. It means a formation of a culture of health in population from school or even in kindergartens. Formation of self-value of health as a factor of active longevity of people. Improving mental and physical health by specific, of course, specific measures, individual. Maintaining health and quality of life. Achieving of individual genetically determined lifespan, life expectancy. It's the maybe most important, most valuable goal of all efforts of healthcare system. What does mean healthy lifestyle? Let's specify this term, very famous. It includes habits, useful habits, not harmful, but useful habits, behavior, specific behavior, social lifestyle of the person, performing them, hygienic skills that contribute to the preservation, maintenance, and promotion of health, volume of health, or result, health result. We can define a few levels. We can divide all prophylactic measures on separate levels. Primary, secondary, and tertiary prophylaxis. It's all main levels of prophylaxis in our daily practice. Of the disease absence, or not confirmed any signs of disease, we should organize primary prophylaxis for eliminating of acting risk factors. For eliminating of acting risk factors, such as hypercholesterolemia, or smoking, or over drinking, overeating too. For patients with confirmed disease, such as hypertension, we should organize as possible early detection and early treatment or correction of conditions which can lead, which can increase, which can support pathological conditions in the onset of this disease. In case of asymptomatic behavior, that's sickness, we should organize already secondary prevention. And in case of clinical behavior sickness, we should organize tertiary prophylaxis or prevention or decrease disease complications. Let's characterize also primary. Now for primary prevention, what does it mean? Primary prevention, a system of measures aimed at eliminating or weakening of the risk factors to reduce the likelihood of disease development. So eliminated or prevention of sedentary lifestyle, it means enough physical activity, as you can see on this picture. It was confirmed that classes, physical activity classes, 3 times a week for 45 minutes for 6 months, leads to decrease in blood pressure for patients. Systolic blood pressure, approximately 10 to 12 millimeter mercury, diastolic blood pressure from 7 also to 12, without any additional medications, without any interventions. What is the role, benefits, or other benefits of good physical activity, except correction, except reducing blood pressure level? Regular moderate physical activity reduces total cholesterol level, LDL cholesterol, and rise high density cholesterol levels. Reduce the risk of coronary heart diseases. Coronary heart disease, diabetes type 2, and hypertension on 30 to 50%. Now I want to demonstrate for you this picture as the recommendations of American Heart Association for physical activity in adults for maintenance of cardiovascular health for overall patients. At least recommended at least 30 minutes moderate intensity aerobic activity, such as walking or walking with dog or with animal, at least 5 days per week for at least total totally 150 minutes weekly. And or at least 25 minutes of vigorous aerobic activity daily, at least 3 days a week. So total, not less than 75 minutes of vigorous aerobic activity. This kind of physical activity may be in combination with moderate or high intensity, from moderate to high intensity muscle strengthening activity, at least 2 days per week, for additional health benefits. As for patients with increased arterial blood pressure and with increased total cholesterol level, we can recommend usual physical activity during 40 minutes. Moderate to vigorous intensity aerobic exercises 3-4 times per week. And as maybe most popular and more effective example of modern and fashion physical activity now in different countries is Nordic walking. Nordic walking, or walking with special sticks. The benefits of this are more intensive energy consumption than usual walking, and participation more large muscle groups than usual walking or jogging. Now the time for possible physical activity, time for short break. Through time, so 10 minutes, we will continue our lecture. And please, group leaders, write to our chat amount of present students from your groups. Now 10 minutes break. Please, group leaders, write list of present students now, except 23rd and 24th group. They wrote already. Break is over, let's continue. And let's speak about smoking and the role of smoking cessation in primary prophylaxis. Smoking increases the risk, you should know that smoking increases the risk of myocardial infarction 2 times and stroke 2 times for all categories of patients. This is very short information. Later, I will present for you modern screening methods for intensity smoking and predisposition to smoking dependence, nicotine dependence too. Which medical organization or prophylactic organization can help to solve the main problems of primary prevention at the population level? There are health centers, organizations, or infrastructure of healthy lifestyle among the population. Main tasks of health center work: forming citizens' responsible attitude to their own health and the health of relatives, motivating them to give up bad habits, assistance during the non-use of alcohol and tobacco smoking, advice on health protection and promotion, including recommendations for the correction of power, physical activity, physical education at sports healthy condition of life and work and recreation. In health centers, we can provide, we can measure some risk factors concerning related to smoking, such as carbon monoxide concentration in exhaled air by patient. This device calls smoke laser. Smoke laser. You can see on the screen of this portable device the concentration of exhaled carbon monoxide level. This concentration, 2 particles per million, it means it's appropriate or corresponds about 1% of carboxyhemoglobin in patients' blood. Also, in health centers, we can provide now diagnostic procedure, composition analysis, or body composition analysis. Examination can help by using special diagnostic system, platform, we can define the percentage or amount of fatty tissue and unfatty tissue, such as muscle, bone tissue, water, of course, general weight. This system uses 8 electrodes for hands and for foot. Promised by me a questionnaire, so very famous as Fagerström test of nicotine dependence detection. This questionnaire contains just 6 questions, relatively simple questions. These questions can help to suspect nicotine dependence for smokers. Pay attention on some questions, especially on questions, for example, number 2. Do you find it difficult to refrain from smoking in places where it is forbidden? For example, in church, at the library, in a movie theater, or we can add to this list in hospitals. And question number 6 also demonstrates high dependence. Do you smoke if you are so ill that you are in bed most of the day? If patient answering yes, it also demonstrates high dependence. According to interpretation of this questionnaire results, total level of more than 7 points indicate severe symptoms and which also associated with difficulties of quitting and possible need for high dose nicotine supplements. More than 8 points, very high level of nicotine dependence. And there's one famous important screening test which we should apply on in health center work. It is screening test for alcohol use disorder identification, AOD test. MSS LD test. It contains 10 questions with different points for each answer. It can suspect predisposition to alcoholism or even can confirm the existing alcoholism for patients. Now let's speak about main screening methods which we can apply for detection of risk factors. Screening destined for early detection of the disease before symptoms appear. Or risk factor by interviews, physical laboratory research, or other procedures can be performed relatively quickly and without serious economical expenses, financial expenses. Now, before main characteristics of screening methods, I'll remind for you most widespread non-infectious disease in population of different countries. In first place, usually arterial hypertension. Second place, coronary artery disease, coronary heart disease, diabetes, cervical cancer as gynecological problem, colon cancer, surgical problem, lung cancer, prostate cancer, mammary cancer. Now, you can see here most widespread screening methods. There are blood pressure measurement, of course, as the most simple screening method, even for self-assessment at home. Pap smear, examination of gynecological problems. Measurement of blood cholesterol and blood glucose level. General urine analysis, also screening, simple screening method. Screening for HIV and hepatitis. Screening for blood. Immunoassays. Fluorography examination of the lungs. Mammography for breast cancer screening. Screening for glaucoma, which you can see on this picture. This is modern indicator of intraocular pressure without contact with eye tissue, contact through palpebra. Except general glucose level, glucose tolerance test, we should suggest for patients, especially with increased level of general glucose. And also recommend procedure for screen palpation of thyroid for early detection of thyroid dysfunction. On this picture, you can see ELS1, very famous screening instrument, screening tool, such as systematic coronary risk evaluation, scale of MSS score scale for examination of 10-year risk of fatal cardiovascular disease, such as myocardial infarction. As you can see, This scale is separated on two parts, divided on two parts for women and for men. And if you are so attentive, you can detect that in equal conditions, the level of risk higher for men than for women, especially for arterial hypertension and the smokers. Maximal risk level 13% for women, maximal risk level, which we can define by this scale for men, 24%. It's likelihood of cardiovascular death due to MI, for example. Which parameters include this simple scale except age and gender? We should know patients' smoking status, smoker or non-smoker, systolic blood pressure level, and level of total cholesterol. Then more systolic blood pressure, then more total cholesterol level, and then more patient's age, then higher risk factors. And also it correlates with smoking status. For smokers, always there's risk, the level of cardiovascular death risk is higher. In International Classification of Diseases, 10th version, we can find the types of medical preventive measures, the special codes. Z. Separate measures, preventive measures are preventive counseling of individuals and population between Z70 to Z76. Medical checkups. Medical checkups to detect early forms of diseases, such as cancer, of course, hypertension, coronary artery disease, and others. And of course, risk factors and conducting recreational activities between Z00, Z30. Immunization and vaccination, most actual problem now, previous and this year too, for prevention of new cases of infection, or for prevention of complicated forms of acute respiratory viral infection caused by new coronavirus infection. Medical examination is also separate form of preventive measures, and preventive health measures or recommendations, individual recommendations according to detected, according to information about detected risk factors. So-called preventive counseling. This topic we'll discuss later as most effective procedure of preventive work, preventive counseling. Despite on the very high importance of preventive work, I should inform you about possible disadvantages of daily preventive work. These disadvantages includes the lack of real measures of primary prevention. And inconsistencies in the management of patients between specialists offering inconsistent recommendations between general practitioner and neurologist, cardiologist, surgeons, and other specialists, which can recommend different procedures without agreement between them. It can cause, it can lead to low adherence to doctor's recommendation from the patient. And now already conclusion of our lecture. This conclusion indicates that each member of the family, regardless of health status, should be not less than 1 time per year be subject to in-depth medical examination. Don't forget about it in your future medical practice, especially for yourself too, for maintenance of your health. I wish you to maintain healthy now and always, and to avoid possible risk factors of chronic disease and, of course, acute diseases too. If you want to ask me any questions, you have 2 minutes. As I see in chat, just how many groups on your course? Who can specify this information? 12? How many groups?
$12 groups, sir.
12, am I right?
Yes, from 23 to 34.
Okay, so all groups, participants are present here. Okay. Do you have any questions for me about primary prophylaxis? The main principle of medicine is any disease is easy to prevent and treat later. Not just easy, but very cheaper. Don't forget about it and use this principle in your daily future practice. So let's complete our lecture. I will wait next meeting with you through 2 weeks, already in March, 4th of March. Friday, also it will Friday, 2 weeks later. Bye, be healthy. In 2 weeks. Good luck.